Hi everyone, my name is Dr. Esiosa Igudaro, and I am a stroke neurologist, a vascular dementia specialist, and a researcher. And today in this video, we're going to be talking about signs and symptoms of stroke. I've started creating these online videos due to a need and a request from patients and the community who are interested in understanding signs and symptoms of stroke and obtaining more educational information. Just wanted to make one disclaimer that these videos that are available online are for educational purposes only. If you have any medical needs, please consult with a licensed professional. Where's the best place to get stroke information? One of the best resources is the American Stroke Association, as shown in this video today. To get to this website, you type in www.stroke.org. And this is one of the leading organizations that shares guidelines on stroke and has the most accurate, up-to-date information related to stroke. So I encourage you all, as you're looking for information on stroke, make sure you're going to accurate sources, one source being the American Stroke Association. So this is their main website, and this is their landing page. And we're going to be going through the signs and symptoms of stroke. So if you look here, you can see different tabs about stroke, life after stroke, help and support, and other different tabs. So let's click on about stroke to go into details regarding what is a stroke. So stroke is the fourth leading cause of death and leading cause of disability in the United States. Therefore, it is important for all of us to be extremely familiar with the signs and symptoms of stroke so that if a loved one or you're having a stroke, we can get to the emergency room ASAP. But then we can also talk about how to prevent strokes. And I'll be talking about that in a later video. So what is a stroke? So there are two kinds of strokes. One is called an ischemic stroke, and a second is called a hemorrhagic stroke. Some of you may be familiar with another term called a transient ischemic attack, aka mini stroke, which is a temporary blockage in the brain where the symptoms resolve on its own and there's no permanent blockage or permanent brain damage. So let's click further to understand what are the different kinds of stroke. So as mentioned earlier, there are two kinds of stroke. There's ischemic stroke. An ischemic stroke is the most common type of stroke, and it's due to a clot or blockage in the blood vessel. And that's what this image here is showing. This is an image of a blood vessel, and this yellow area is the clot or the blockage. And what happens in an ischemic stroke is in our blood vessels, blood flows to the brain and it allows for oxygen to be delivered around the brain tissue. But when we have a blockage, such as what we see here, then blood flow is not able to travel to the brain. It leads to reduced blood flow, and then that leads to lack of oxygen and nutrients being delivered to the brain, and that's what leads to an ischemic stroke. This process is similar as to what happens when individuals are having a heart attack, where there is blockage in one of the heart vessels or coronary vessels that leads to ischemic damage of the heart. A similar process is happening in the brain, and that's what we call an ischemic stroke. Another kind of stroke is a hemorrhagic stroke, which is a bleeding of the brain. What happens in a hemorrhagic stroke is the blood vessel wall becomes weakened, and as that wall weakens, sometimes with due to extremely high blood pressures, the wall that weakens ruptures, and then all that blood that's supposed to stay in the blood vessel is now spewing into the surrounding brain tissue, leading to signs and symptoms of a hemorrhagic stroke. Let's scroll further down to discuss additional information. There is also a term called an transient ischemic attack, which is also known as TIA or a mini stroke. The TIA falls under the category of an ischemic stroke, but the main difference between a TIA and an ischemic stroke is that a TIA, the symptoms are temporary due to the clot being temporary. So if you're having signs and symptoms of stroke, it's extremely important to call 911 immediately. So let's talk about, now that we've talked about the types of stroke, let's talk about what the symptoms of stroke are. So we go back to this tab here. Let's click on stroke symptoms. And let's talk about stroke symptoms. One way to remember the warning signs of a stroke is the mnemonic called F.A.S.T. So what does F.A.S.T stand for? It stands for balance loss, eye, vision changes, facial droop, weakness of the arm, speech difficulties, and the T is for time, meaning call 911. These are the symptoms that people can have when they're experiencing a stroke. So let's go into more detail about each of these symptoms. So the B for balance. When individuals are having an ischemic stroke, hemorrhagic stroke, or TIA, it can affect their balance, which looks like difficulties walking, falling, tripping over one's legs. That happens all of a sudden. So if you or a loved one are experiencing those symptoms, it's important to go to the hospital immediately. The E stands for vision changes. In the stroke, one can have an acute, sudden change in their vision. Mostly this is complete loss of vision, or part of your vision is lost, sometimes not being able to see in your peripheral or losing vision in one eye. Those are warning signs that it could potentially be a stroke, so it's important to go to the emergency room ASAP. Another sign of stroke is facial droop. So in this mnemonic, that begins with F, face drooping. So if you know anyone or you having face drooping that's on one side, you need to go to the emergency room because that could be a sign of a stroke. The A stands for arm weakness. Individuals who have a stroke, their arm could be weak or one side. Also, you could have arm weakness or you could have leg weakness. So if you're having those symptoms, you need to go to the emergency room. In addition to arm and leg weakness, although it's not shown here, you can also have numbness, tingling on one side of the body that comes on all of a sudden. If you experience those symptoms, it's also important to go to the emergency room. The S here stands for speech difficulties. That can present as having slurred speech, sounding like one is intoxicated, not being able to get your words out, having difficulty speaking or thinking, or your words sound mumbled. If you're having those symptoms or someone you love, time to go to the emergency room. And T is the reminder for time. Call 911 ASAP. Many times I see patients who've had these symptoms but thought that they would go away, so they didn't present in emergently, or they presented a few days later. And the reason why it's important to go to the emergency room ASAP is because stroke is a medical emergency, just like a heart attack. If you have these symptoms, you need to go to the emergency room, seek treatment so that we can give you the treatment that's available for patients who are having a stroke. And remember, be fast. What are some of the other stroke symptoms? Like we talked about, you can have numbness or weakness of your face, arm, and leg. That's especially on one side of the body. Confusion. You can also have severe headaches. So remember, be fast. Call 911. In later videos, I'm going to be talking about how can we treat a stroke if someone comes to the emergency room, and what are the risk factors for stroke, and how do we prevent strokes. So I encourage you to take a look at some of my other videos that are focused on stroke prevention. If you have any questions, comments, or there are topics that you would like for me to discuss, feel free to post on the comments below or send me an email using my email listed below, and I will look into creating videos on those topics if possible. And I look forward to having you all at our next video. Hope you all have a great day, and we'll talk to you later.